Well, here's a truly great new idea to get more doctors and nurse practitioners where they're really needed in regional communities. We've spoken about this so many times before. A new scheme, though, from the federal government plans to wipe the university debt of doctors and nurse practitioners if they meet a few conditions. They have to work at least 24 hours a week in a remote community for a period of half the length of their degree, or in a rural or regional area for 24 hours a week over a period as long as their degree. Joining me now is Regional Health Minister David Gillespie. David, it all sounds fantastic. Firstly, who came up with the idea?
Oh, well, we can't possibly say, but I might have had something to do with it.
We have spoken about this problem before. Will it work?
Look, I think it is a timely, targeted measure to get the sliding door moment happen for doctors who choose to go rural and stay rural for a significant period. As you know, we've got a wonderful setup of 21 rural clinical schools and university departments where they go for 6 weeks, 6 months, a year, or the end-to-end Murray-Darling School network. But what we want is them to stay once they're a practicing doctor. If you choose and you stay, we will waive your HECS health debt. If it's in the inner and outer regional towns, you know, the 5, 10, 25,000 population towns, it's 1 for 1. So if you did a 6-year degree, you have to do 6 years to get the full waiver of fees. If you go remote, you get 2 for 1. So you only have to do 3 years instead of 6. But when these young doctors are setting up their own practice, or they're getting into their senior registrar years when they're almost finished their college degree, which you get after med school, it will change the dial. We won't know for sure till it happens. But I know a lot of young doctors have got a huge debt. They've also accumulated a family more often than not because they're much older now. You've got to do 3 degrees to become a fully franked GP or specialist, and it will shift the dial.
So this will shift the dial by how much? About $100,000, I read.
Roughly, yes. If you've done a 6-year degree, that's about where it is. And it's a proportionate measure. General practitioners and nurse practitioners are really valued parts of our health system. We need both of them in country, regional and rural and remote areas because the level of access to doctors and skilled nurse practitioners compared to what you can have at your fingertips in the city is quite staggering. We have worse health outcomes in the country. We have less spent on health in the country because we don't have enough professionals. We have a wonderful demand-driven system, whereas if you see someone, you can get paid you get a rebate out of Medicare. But if there's no doctors, or they're hundreds of miles away, or the hospital's closed down, it doesn't work for you. And this is one way we're addressing it.
Previous schemes have allowed doctors to be exposed to life as a GP, or at least working in a hospital in country areas. That simply has not been enough to keep them here. So what are stakeholders saying to you in regional health communities about whether this is going to work or not?
Well, the feedback that I've got from the rural doctors groups is really positive. They think it's a fantastic initiative. You know, as I said, there's a sliding door moment when you are training to be a fully franked doctor, stand on your own 2 feet, and you're thinking, oh, will I go back to the big smoke? Because we already have them training for half their time in the country, but we see from the figures, as soon as they get their full fellowship and they are not bound to be there, they go, or too many of them go. We can't get everyone to stay there, but that will tip the balance because, see, if you move back to the cities where you get wealthier populations, people pay more to go to the doctor. And that is a conscious thought in many people because if you've got a partner and families and a mortgage and you think you're going to do better, that tips the balance.
And you've got a $100,000 debt, by the way.
Exactly, yeah. Look, money does count. Money talks. So it will influence some. It will tip them over what they wanted to do anyhow, but they are forced to because they think there's a lesser or it's a more difficult option for them. But we really have to get more skilled practitioners into these country towns, because the hospitals need the GPs and people like midwives and nurse practitioners to treat people. And because we've got a shortage, with too many of them staying in the cities and the metro areas, a lot of these country hospitals, which is shown in the Bush Summit, shown in the Daily Telegraph inquiries in Victoria. We need skilled multidisciplinary care in country areas, because country areas aren't getting the same deal as they are in cities. And I must say, in some cities there's over-servicing, and we're just trying to balance the ledger.
And how did you convince the Treasurer to forego that large chunk of revenue?
Look, it is really important that Australians have access to medical care and a skilled medical professional, whether it's a clinical psych. I mean, as you know, Chris, I practiced in regional Australia for 23 years before I entered Parliament.
Yep.
You know, I've seen how it can work. You can get good care if you get the right cluster of medical professionals. You know, you need pharmacists, physios, psychologists, or a GP obstetrician, a GP anaesthetist that can work at the local hospital and deal with road trauma and heart attacks, rather than coming in, having a telehealth consult, being put in the back of an ambulance and being driven 300 k's away or put in an air ambulance. That's not good enough. Regional and rural and remote Australians deserve to get the best that everyone else in inner metro parts of Australia get. And this is one way of getting more professionals there.
Just a quick comment on today's announcement that we will join this diplomatic boycott of the Beijing Winter Olympics. China isn't happy. Are you expecting some kind of counter-attack from them?
Look, the best predictor of that, Chris, is past performance. But I think they've learned you can cut your nose off to spite your face when you try and target and ruin another country's economy. The rest of the world notices what China did to us with the barley and the wine and our timber and all those things that they tried to boycott, the coal. They ended up freezing in winter, and in the end they've started taking it back again. They need our good black coal. They love our wine and our produce. And if we don't stand up to this, they will be emboldened. And this is a very effective way, because they put a lot into their Winter Olympics. The athletes can go, but obviously diplomatic and government representatives won't. And it will send a powerful message. We're not the only country that's decided to do this. The Uyghurs and all those people who are getting bad treatment and restriction of freedoms will be better off when many more countries address the problems that we see. We want to do business with you, but there's a line we draw in the sand.
David Gillespie, thank you very much for your time.
My pleasure, Chris.